their pathways into homelessness are often different. So the reasons they fall into homelessness, there's obviously some commonalities, but the reasons they are there are very different. And like I said, for women, a lot of it is driven by violence, experiences of violence, fleeing abusers, and people who are exploiting them. And so, there are gender differences in homelessness. So women experience it differently than men do. And so if their pathways in, their personal experiences are different, then the responses to their experiences need to be different. Mm-hmm. And so, I think what we've seen in terms of service delivery for women has really been this move towards understanding the gender differences and recognizing that safety from abusers, safety from people who may be exploiting them is a key concern in terms of the type of housing that they need, which may need to be more secure with more stricter policies in terms of guest management. We also need to be mindful of the fact that many women have children who may or may not be in their care. And many of the women that I've met in homelessness have lost their children, multiple children, to the child welfare system. And that just exacerbates their trauma. And so this idea of healing and what women need to heal is quite different, but also their housing needs, I think, are quite different.
Mm-hmm, mm-hmm. So more security because there's a heightened risk.
A heightened risk, and I think the response to the trauma that they've experienced is critically important. We have this sort of buzzword, trauma-informed care, everybody's talking about, and my fear is that it has become one of those things that we say, we did a 3-hour online module, and so now we understand what trauma-informed care is. But really, when we're talking about women in homelessness, trauma-informed care is very, very important in terms of acknowledging and responding to the history of violence and exploitation that women have been. By the time they get to shelter, they've been through a lot. And so informed care is critically important in addition to safety.